All right, let's switch gears into standard 3, starting with 3.1, assessment and planning. And I will try and whiz through this as quickly as I can, because I think and I hope you're all getting the gist of the process. You know, we are looking at the outcome, we're assessing the risk based on a criteria, we're thinking, is education needed? If so, why? What's the rationale or evidence? Specifically, a lot of examples have come from multiple legislative requirements, our evidence mapping framework, which is the document auditors will use, or the sector performance report. So actual, data. We've got a clear rationale that is informing why education is needed, but in some cases, we're suggesting a secondary strategy as well. So when it comes to outcome 3.1, assessment and planning, we obviously have a lot of different modules relating to this. And the rationale for deeming these 13 topics, which I know sounds like a lot, as high risk is the page 63 of the evidence mapping framework, which again specifically asks for evidence of training on these particular topics. Outcome 3.2, diversity of care and services. I guess I'd just highlight, restrictive practices and dignity of risk as key risks to address here. And the reason why is I think we're seeing that, especially for some of our clinical staff, it may be overlooked. So that's why I guess we're really proud to have a huge volume of content on a particular topic that can suit your different target audiences, different job roles, different durations. So there might be, one topic or one module that you're using, but just expand the focus a little bit and think, hang on, we may have a different duration of module on a same or very similar topic that might be more suited to a different job role. Rather than this one size fits all approach, just really encourage you to think about those key tenets. So what is the right vehicle? Is education needed? What's the right format? What's the right duration? What's the right way to approach this particular topic for this particular target audience? Keep pressing on. 3.3, communicating for safety and quality, transitions of care and deterioration. You'll start to see deterioration come up a lot, and we definitely identify this as high risk. Anyone with an acute care background will know that we have to be recognising and responding to clinical deterioration effectively. But what we will say is we probably recommend addressing this type of topic when we get to standard 5, where we're really looking at clinical care as a whole picture. So again, just suggesting that even if you've got some of these high risk topics sitting within standard 3, it may be better to even if they're high risk, leave them where they are now for standard 3, and then address them a little bit more holistically when we're looking at standard 5. So 3.4, coordination of care and services. This is a really interesting one. I think this topic talks to a trend that we're certainly observing, and that's that residential aged care facilities, are becoming more of a subacute environment. So, what does that mean? We have older people moving from a home to hospital, rehab back to a facility. And, we've been a publisher for over 30 years. We have a large library and, perhaps even the largest in the country when it comes to evidence-based content. But even within that library, we have gaps. So we're using this same process, this same systematic approach to internally address and respond to the gaps in our library as a team as well. So transitions of care is a gap that we're looking at filling at the moment as well. All right, we're almost there, doing very well. Another little meme for the cat lovers out there. Oh no, that's a dog, little pug. We're almost there anyway.